Hi, I'm Amanda Olson, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And I'm coming to you from intimaterose.com to talk about Kegel exercises for beginners. And a Kegel exercise at the end of the day is simply a contraction of the pelvic floor muscles. And the pelvic floor muscles are in the pelvis. So this is the front and this is the back. And everything that you see in red here is the pelvic floor muscles. We have a superficial group that goes around the urethra, the vagina, and the rectum. And we have a deep group that does the same thing. So the bladder would be in the front, and the urethra here, and the vagina and the uterus in the middle, and the rectum in the back. So with the organs in, it looks like this. Bladder in the front, vagina and uterus in the middle, unless you've had it surgically removed, the uterus, and then rectum in the back. So the organs sit right next to each other, right like that. And so a Kegel is just a contraction of those muscles. And when the muscles contract properly, they lift, they squeeze together and they lift up and in the pelvic bowl, in like this. So if you can imagine a downward dome coming up and in. And the best way to achieve that contraction is to imagine that you are shutting off the flow of urine and pulling up. So one way to go about that is to actually practice it on the toilet, shutting off the flow of urine, but you only want to do that once. You're not going to use that as a training method because that can actually lead to damage of the pelvic floor muscles. When we're urinating on the toilet, we want those muscles just to relax. But you can try that test once to see if you can do it. So another way to imagine it is that the urethra, where the urine comes out, is a telescope, and that you're pulling that telescope up and into your body. So that is all a Kegel is. And you can practice that in lying down on your back. You can also practice it sitting. Sometimes people that are beginners have better luck doing it sitting because you are having a little bit of feedback from the chair that you're sitting on. So you want to sit on a nice supportive chair. And the pelvic floor lies against that, and you're actually contracting up and away from that chair. There are many ways to make Kegels more challenging, and we'll talk about that more in Kegels for advanced practitioners.